want to thank you for having me here today to give a presentation. I take care of, I'm a chiropractor in Plymouth. I'm Dr. Mike Harkins. I practice in Wisconsin, near Green Bay, Wisconsin, for the last 24 years. And I moved over here to be closer to family. And I have a mission in life is to help as many people as I can. I've been practicing chiropractic for 36 years. I graduated Northwestern Health Sciences University in 1983 in Bloomington. At that time, it was in St. Paul. And since then, they moved to Bloomington. They have a beautiful campus there. They also have acupuncture and massage therapy there also. So in my practice of 36 years, what I want to do is educate as much as I treat my patients. We are born into this world. I tell my patients we're designed, manufactured, and engineered in heaven. Then we're brought down to earth here. And we spend the rest of our life beating the daylights out of these poor bodies of ours. And what we do to get them healthy again is typically, Western medicine has wonderful things, but a lot of the care is focused on symptom relief and pills and things like that. And as a chiropractor, we like to get back to the basics as much as we can and restore the body's ability to run and regulate itself as it was designed. So you need hopefully less medications or less medical intervention. You always want to think about being proactive in your life instead of reactive. Not taking care of your diet, not exercising, stressing your body out with work and family and life, and then having heart problems or a heart attack later. And then having to deal with it later at the hospital at 3 a.m. in the morning. That's called reactive care. What we want to do is do very good nutrition, keep your stress low, meditate, keep your nervous system happy, calm, peaceful, and eat good, all those wonderful things. That's proactive. That's staying ahead of the game. So you don't end up in a hospital at 3 in the morning with an ambulance ride. So as a chiropractor, we go through some evaluations of the spine. Yep, go ahead. I'm sorry. We put that in there for you guys. So you go ahead. That's not my house. Dr. Palmer over here, he was his dad started the fundamentals of chiropractic in the late 1800s. He started at Palmer College of Chiropractic in Iowa. And basically what they found back in the day, this was in the late 1800s, that if you keep the nerve system, especially the brainstem area, along the spine, keep everything lined up and freely moving, it stays more peaceful and calm. Then the brain can listen to all of its trillions of cells and send out energy and information accordingly. So it's this constant built-in internet system in the body. But it's not Wi-Fi, it's hardwired, as far as we know. So with the Wi-Fi system, or the hardware system, there's a lot of opportunity for the wearers to get irritated, stressed, compressed, bothered, inflamed. And that's where we come in. And that affects the ability of the brain to listen and regulate its own body cells. Every cell. Even the immune system, every floating little cell is under the control of the nerve system, the brain. So we'll see what's next there. And this talks about when there's irritation or stress to the nerve system. It doesn't have to be a direct pressure like your finger and pliers. There can be just misalignments in the spine, which creates hydraulic pressures, fluid pressures, inflammation. And that's like pouring gasoline if you have sunburned skin. It just burns and bothers the nerves. And then the poor nerve can't carry information as it was designed. And then function of the cells on the receiving end of the nerves can diminish. So if you think of yourself like a bright light bulb, that's the way we're all designed. Be like a bright light bulb and shine our whole life. And then when our life is supposed to be done, yet the light bulb. So with chiropractic, same thing. So we want to keep the power high, pressure off the nerves and wires. So the next one, and this talks about basic healing forces of the body. So if you cut yourself in the kitchen, chopping up some vegetables, do you have to sit and worry about that healing? Typically, no. Your body will take care of that on its own. Because we have all of an innate ability for the body to heal. It's called innate intelligence. So if you fall and break your leg, you maybe get a set by the medical doctor if you need to. But then who actually heals that? Your own body does. It gathers, it takes from other parts of the body if it needs to, from the new nutrition coming in and rebuilds all the damaged tissues to get them happy again. chiropractic's organic. There's no chemicals, no drugs. We don't do any injections, anything like that. Just helping that nervous system stay in touch with itself. Okay. And I know with the Indian culture, you guys are very much in tune with that already. You guys are like leading the world in all of those things. And nutrition, and vegetarianism, meditation. Look at all those wonderful things your culture has given to the world. But unfortunately, most people don't use it, you know. So subluxation is what we work on. So we've all heard of dislocated joints. If you dislocate your shoulder in a football game or something, or soccer, if you fall there, and then they set that. With subluxation, sub means under, like submarine. So that's where part of a joint will come off center from where it's designed to be, from its true place of where it's supposed to rotate and support. It is off kilter a little bit, and it gets stuck there, and it gets adhesions. It can scar tissue up, it stays there, it doesn't move well anymore. Joints that don't move well anymore don't get lubrication, they don't get nutrition, and they start to deteriorate. So we look at the spine, we check all along the cool joints. There's 7 vertebrae in the neck, this 12-pound skull, head sits on top of all of that. There's 12 mid-back, 5 low-back, sacrum, and pelvis. And everything's designed to be just beautiful, stacked, gorgeous, transfer weight from above down to below. You have these wonderful discs between the bones that have a liquid ball-bearing center, nucleus pulposus. So when you bend this way or that way, they all are there to help make that happen. And help keep the openings for the nerves big. But as time goes on with injuries, stress, poor posture, any kind of damage, the discs can get worn down, the bones can shift, they subluxate out of place with one another. It's a relative thing, and they can compress the environment and inflame that whole area. So sometimes we'll have stiff necks, sore necks, mid-backs that drive us crazy, low backs, we put Bengay and things on our back, have somebody rub our back and massages and things. But down below, deep in the spine, the bones are twisted from car accidents, injuries, hitting your head going into grandpa's basement on the low ceiling or whatever, playing sports. Even the birth process itself can be extremely traumatic to a child. It floats in a womb in water for 9 months. Then it gets forced out into this world. Somebody grabs his head and they pull it, you know. I'm just exaggerating that. But they can use forceps. Even C-sections can be very traumatic to the children. So they get a lot of problems at birth to the upper neck. So we see children in our clinic that have a lot of colic. Maybe they don't hold their head right, they get torticollis. Usually it's from the birth process, things like that. So we can help that too. We've had babies come in that mom's brought them in, they're just stressed out because the baby cries all night long. Mom can't sleep at all, nobody can sleep in the house. And they're just at wit's end. So what we do, we'll check their little brainstem area up here. We just want that, again, calm and peaceful. It's all engineered and designed like a Swiss watch. It's beautiful. Cerebrospinal fluid flows from the brain down through the spine, goes back up, pumps back up, keeps everything bathed and happy. And with the baby, they have pressure there, even a little bit. It can throw turbulence. It's like throwing a rock, a big boulder in a little stream. It creates a little turbulence. They're not comfortable, they're not happy, they don't fall asleep deep. So then, up all night, they cry. So this one mom brought her baby in, and so we give baby a little adjustment. I can detect it with my hands, look for areas that are stuck or sticking out, things like that. And give a little adjustment. And she went home that night. She called me the next day. She says, I didn't get any sleep last night. I said, what? How did it go? She goes, my baby didn't make one sound all night. And I thought he had died. So she was getting up about every 10 minutes to check on her baby, because it's supposed to be screaming all night. But the baby was so exhausted because it hadn't slept in about 3 months. So it got its first good night's sleep since it was alive. And all she did was take a little pressure, we corrected the subluxation up higher here. So subluxation, like on that last one, the top is normal, shows the discs and the bones, etc. The subluxated shows where the nerve is irritated. That's a simplified version, but a lot of things happen. And subluxations can come from poor posture. You know, does everybody always sit up real straight all the time here? We're just perfect. Do we stand straight? You know, do we lift perfect? You know, how many of us look down every day like this all day at our phones? When I walked through the entranceway out here, everybody out there was like this on their phones, you know. And what that's doing now, this whole new generation of kids, and you know, all you guys that have teenagers, you'll see it already. They're developing this. So when they get to be retirement age, they're going to be walking around like this, I think, you know. And so we try to get kids to do, and even adults do. Instead of bringing your head down to the phone, bring the phone up to your head, put your elbows there, and that'll help a lot. And then using the phone less is nice too, but that's hard to get away from. Like every time you try to relax and get away from the phone, it pings. Of course, you have to go over and check it, right? Drop everything, go over there, pick it up, and someone posts a picture of their plate of food that day. You know, it's all day long. It's like that, you know. So we try to get my kids and stuff to set the phone down, but it's hard to do in this society. So let's see what else we got here for us. Go ahead, one more. Yep. And then subluxation again is the enemy to the nervous system. I wrote this stuff up here. The nervous system is our master system that manages and runs this body we have. We want to get this body running great so we can enjoy life. We want to sleep deep at night. You don't just want to sleep. You want to sleep deep, right? Anybody ever sleep all night and you're still exhausted all the time? You don't get that nice deep sleep. So when you have pressures on your nervous system, you may not even feel it, but it's like someone's ringing your doorbell all night long. It's a constant irritant to the nervous system. So the body at night does some really cool things. Just like when your temple is busy here, nobody's really running around maintaining it because there's people everywhere and bathrooms are busy, the kitchen's busy, the kids are tearing around. But when everybody leaves, then the maintenance crew comes out. They can straighten up the chairs, the tables, clean the floors, empty the trash buckets, all that stuff. Our bodies are a lot like that too. So all day long, we have busy stuff going on. So our maintenance crew, our immune system, kind of sits back, just waits for the day to get done. It does what it has to during the day. But at night, it comes out, it repairs damage to our body and all of our cells from the day. And it prepares it for the next day, gets it ready. The immune system comes out because it has more energy. The body only has so much energy. So it has to go to digestion during the day, and thinking and driving and such. But at night, that's shut down. So all that extra energy can go into your immune system. It goes out seeking out cancer cells, dead and dying cells, kills those things off. So it repairs your heart. So it's important to get that really nice sleep. Again, taking care of that spine. There's so many vulnerable areas along there that can mess up our life and our health. So, and it's not just back pain, neck pain, it's everything. Everything runs off of that. So, and then subluxation is what I detected. In my office, we use, we sit down with our patients, check you over, call it touch and feel. Feel along your spine really good. And I'll find sore areas that you knew were there and sore areas that you didn't know were there. And I had a gal the other day, I said, she was about 26, and she had a broken bone in her low back. She didn't know. It's called the spondylolisthesis at the L5 vertebra. So the bone back of it broke when you're little and it slides forward. And then something happens when you're about 7. So I said, you've got a broken bone here. It happened when you're about 7. You probably fell off the swing set. Because the bones at that time aren't real hard yet. They're still kind of cartilaginous, like chicken cartilage. So if you put a stress on it, it can break. So she goes, I don't know anything about that. So she went home and asked her mother. This little girl's she's a nursing student. And mom said, well, yeah, you fell off the swing set when you were 7 years old, really hard. You hurt your back. So anyway, so that's the kind of things we check on the spine. We feel on the sacroiliac joints all the way up the back to the neck. I also use a little device. This is called a temposcope. And it's got basically 2 heat-seeking prongs here. We slide that along each side of the spine. And if one spot has inflammation on one side, or it's hot compared to the other side, the needle here will swing in that direction, just like that, if you can see that. And then if that would indicate a site of some heat, irritation, which might indicate pressure or subluxation at that level of the spine. If it's a chronic condition, that area might get congested. It might actually swing in a healthy direction because it's congested over there, decreased blood flow, things like that. So we do that too, especially on the brainstem. So if there's anybody here, I brought this with today. If you've want to get checked, it just takes about 20 seconds. When we're done here, have a seat over here. I'll just slide up your neck and see how your brainstem's looking. We like the needle to be straight down the middle. Okay, what's next there? Children. Everybody here is a child of somebody. Do we have children, most of us here? Some are little and babies, and some are adults tearing around the planet doing their thing. So with the children, this is a big focus for us because we see so much autism, attention deficit disorder today, misbehaving kids, kids that, they're just hyperactive, they're not learning at their level that they should. Their brain just doesn't function at the capacity, the level that it should. And there's a lot of reasons for that. One of them can be, again, subluxation of the spine, especially the upper neck. It has a lot to do with behavior, ability to learn children, like math, sciences, engineering, things like that. Ability for the cerebellum to process. So when there's been studies done, when the spine is adjusted by a chiropractor where there's problems, the behaviors change for the better. The needle tips in a good direction. Ability to learn goes in a good direction. Ability to sleep and digest, things like that. It goes in a good direction again. So with children, like most of us, we were all wild, crazy kids when we were little, playing sports, jumping out of trees and wrestling, and get a lot of injuries in the birth process itself. So it's always nice, in my practice, we love to take care of children because it's brand new to them. They grow up in a world with the knowledge I can share with them, how to take care of themselves going forth in life. Otherwise, who trains us on our healthcare today? It's television. Anybody ever see ads for this drug or that drug? I mean, no matter what it is, it gets a title today, it's a new name. And there's the cure for it, it's a drug. Do drugs really cure anything for the most part? So if an elephant stamps on your foot, and he stands there on your foot, and that probably would hurt quite a bit and damage tissues and things. You can leave the elephant there and take pain pills so you don't feel it, or get injections around it, or anti-inflammatories, things like that. And that's okay for the temporary, but you have to realize it's not really solving the problem. The real problem we want is to get that, hey, elephant, please get off my foot, will you? Killing me here. And then it has a chance to heal again. So a lot of our health issues, we always want to check, not that there's not a need for medicine. I have a brother who's a surgeon, one is a dentist also. I like to think I'm the smartest of the doctors, so they don't agree with me on that. But at any rate, there's a time and a place for medicine. We all know that. But there's a time and a place for taking care of yourself too. Get your nerve system plugged back into your body, and your body plugged back into your nerve system. Your body can run and regulate itself at the highest level that your Creator designed you to be. Most of us are, if you can imagine, a light bulb hooked up to a dimmer switch. Again, when we're born, it's nice and bright. When we get ready to die, it's supposed to still be bright and just go out all at once. Not these long, slow, deteriorating, dimming for years, So you want to keep it high all the time. That's our goal. With chiropractic, that helps in that direction. Along with our good nutrition, along with good exercise, along with good mental thought. Even mental thought, stress, can pull your spine out of place. Just the tension and things like that. So we just want to get into meditate. And meditate, our brains have a thing called this ego. It's always like getting us in trouble and bad talking us and saying bad things about ourselves. And inside of that, outside of that is awareness. Of course, you have good consciousness. So you just want to meditate helps push that ego aside and just kind of just be who you really are down below. So, and it's hard to stay in that state of awareness and consciousness all the time. There's just too much going on. But if you could give your brain and body a break a few times a day, and all you have to do, let's do it right now, just close your eyes and take a nice deep breath in and focus only on the breath going in your lungs and going back out, nothing else. Do that a few times. Now you shut off the ego part of our brains. You're just kind of in touch with awareness. So do that a few times during the day. Maybe when you first get up in the morning, then think some good thoughts about being grateful about your family and life and what the world will have for you today. What's happened in the past, as we know, it's gone. What's happened in the future isn't here. It's not here. The only thing we have is right now, this moment right now. So you always want to kind of stay in that as much as you can. Although it's hard not to look back and forward once in a while too. So let's go to the next one, Arvin. And okay, let's do the next one. And there you go. And a lot of the things we worked on today, the autism is really big today. The number of children that have it compared to like 100 years ago is mind-boggling. And I just watched, we don't know all the causes of it, but some children apparently have maybe some genetic little trip switches in there that if certain chemicals or things trip that, it kicks that off. And you see that with some of the components of maybe certain medications or vaccines too. I just watched a video about a mother, she had triplets. And they went and got, I forgot what shot it was, but they got the shot and she could shut off, the brain shut off right in a row, boom, boom, boom. And now the children are ruined forever. And for those little kids, there was something in that particular vaccine that triggered that in them. And another kid might be fine with that vaccine too, you know? So that's why you always want to question what am I putting into my children as far as food, chemicals, even our water today. There's fluoride in there. Fluoride, sodium fluoride is a component of Prozac. That's in all of our water sources today. And so try to get that out of there if you can. There are filters you can buy to get the fluoride out. But you want anything to interfere with that brain function. You want to keep it calm, peaceful, and nice. The body loves good exercise, good food, you know, calm, peaceful, nutrition, things like that. It doesn't want all this other weird man-made stuff if you can help it. Okay. Yeah, we do like acid reflux, sinus congestion. We see kids for bedwetting a lot. And when the sacrum down here, tailbone is developing, it has 5 separate segments, and they slide open and shut like a dresser door until we get about 18, 19 that fuse into one big bone in the tailbone. But the second or third segment, if it slides back a little bit due to a fall or posture, that can crowd the parasympathetic nerves that run the bladder. Those are the nerves that when you lose consciousness at night and go to sleep, those are the ones that take over and keep the bladder from emptying. So wouldn't it be nice to keep that nerve calm and peaceful? Well, some little kids, their whole life they're wetting the bed, because as soon as they fall asleep, they wet the bed. So what we do, knowing that, we stimulate that area, we adjust that little part of the bone forward. It sounds like you're closing a dresser door from about that far up. Goes right in. And almost always, that take that pressure off the nerve, that child can now start sleeping over at his friend's house, and everything starts working. The brain's back in connection with his bladder. Isn't that cool? It changes lives for people, kids that do that. And then acid reflux in the body, we see a lot of people with ulcers and things too. So the standard Western thing would be to take some antacids, but it's not an anti-acid issue because the acid in our stomachs is enough to burn a hole through your car almost. You can't take enough anti-acid forever. So what we do, there's a communication problem with the brain down to the glands that produce mucus that line the stomach to protect it from the acid that's designed to digest our food that we eat. So there's 2 sets of nerves that run to every cell. There's a parasympathetic, which slows things down, and sympathetic, which speeds things up. The pharmacy companies know that, so they try to pack as much as they can. They sell you that stuff. And what we want to do is get the body producing and doing its own thing, making its own chemicals. So we see a lot of patients come in, doc, my mid-back is out, thoracic 6, that's the one, or their atlas up here has a lot to do, the vagus nerve. The cranial number 10 is the vagus nerve. It's called the vagabond nerve, so it wanders through the whole body. So those are big ones, sleep disturbances, ear infections, we see a lot of that. Pressures in the neck control open blood vessels, so those valves. So if you get pressure that opens them up and that's bothered, the blood vessel circulation to areas that carry the immune system in is diminished. And then bugs are around everywhere. You can't kill all the bacteria. So they're opportunistic, and when they see weakened tissues, that's their job, to go in and kill it and eat it up. Okay, just like that. You see the crows on the road and there's a roadkill of a rabbit or something. That's their job. They come clean up the rabbit. And so those bacteria, you can't kill them all. So what we want to do is strengthen the tissues instead. So we'll adjust here, and that gives the body's ability to be more calm and peaceful and regulate the blood flow and immune system function in and out of an area. You see those chronic infections go away because the vibration in the tissues ramps up again. And the bugs go, okay, just sit back and wait again for things to get bad. But you can sit and drug and kill that bacteria over and over if you want. I've even had patients come in and they'll punch a hole through the eardrum. The MDs will, they'll let the bad bacteria out. And they're everywhere. You can't kill them all. So anyway, so we want to work a lot with ear infections too. And so all those things are good things. Arvin, next one please. Thank you. This talks just about a lot of stress in children from the birth process. And did you have a question?
Yes, can we go back to the slide before? I just wanted to let people know I'm a chiropractor also.
Are you? Awesome.
And yes, I retired though 15 years ago. I have a nonprofit, so I'm involved with NSA.
Awesome.
But this was very common, guys. You know, I used to, I mean, Dr. Sanis and Dr. Saxena, and they have called me up because I used to treat, half my practice was kids. And I would have calls from medical doctors asking me, hey, what happened? We were going to go in and put in the tubes, right, for the ear infection. They have just been seeing you for the last week, and now we don't need to put in the tubes. What's going on here, right? They didn't realize.
Yep.
So it was educating them. I had babies all the time, and I used to treat a lot of women when they were pregnant.
Yes.
So on their way home, they would stop with their babies right at the clinic. I would adjust them and the babies right away so they were not colicky.
Yes.
Because when they pull them out with natural childbirth, or you know, even if they have a C-section, they
Yes.
still use the forceps.
Yes.
So it really causes problems there. And then that asymmetrical head shape, guys, that's very common. You know, people don't realize chiropractors can help there, just because that skull is still malleable. So when the baby's lying on the side, or depending on for birth, you know, so the skull is not very symmetrical. So we can mold it and bring it back in shape. And all these kind of, my kids, I used to treat them, right? So they were never, until they, you know, went to college and stuff, then it was difficult, but they've never been on any antibiotics growing up, because I would catch it right away and, you know, adjust them. And bedwetting was just, and especially that was very, very rewarding.
Yes.
Because these kids now, you know, they can go to their friends and stay overnight without having to worry. That bedwetting is very psychologically,
Yes.
it really makes a big
Very damaging.
impact,
Yes.
right? So, especially, and we, you know, we Indians are really used to the natural way.
Yes. No, you guys are
And
awesome
so
culture.
all this stuff, especially with kids, I think it is, and of course adults, you know,
Adults
but
too.
if we can get to
Big
them
kids.
with the kids, because we don't want to start them with medication, right? And with this new science of epigenetics and neurogenesis, as well as brain neuroplasticity, chiropractic works great. That's what I give tons now. I've been focusing on the brain, so I give all these workshops and how that's why chiropractic works, right? The
Absolutely.
natural way.
Oh, that's absolutely. Yeah. Thank you so much, doctor. What's your last name?
My name is Geeta Vora.
All right. Well, thank you so much for sharing that with us too. That adds credibility to my speech today. Thank you. I didn't pay her to come here and say that.
Yes.
But yeah, so can't say any more than that. It doesn't matter what organ it is; it's all the same. We treat pain, of course, too. I had a patient that she was probably about 78 or so. I had taken care of her. She'd been under chiropractic care since she was a kid. Nicest lady. She had terrible eye pain, like an ice pick in her eye for years. So she comes in, and I said, and the medical doctors, the best eye specialists in that part of Wisconsin, their opinion, here's what they were going to do. You have pain? Pain is your problem. Of course it wasn't. Let's give you some pain pills. Well, that didn't work. There must be too much pressure in the eyeball from the fluid, right? That must be causing the pain. So it took a needle, pushed into the eyeball, and you pulled out some fluid to decrease the pressure onto the nerves in the back of the eye. And that helped for a little while, but the body, in its intelligence, puts the fluid back in there. Because it has to be at a certain, like our tires, it's like it self-inflates. And that didn't work. So she came to me, and they gave her two options then. So they said, we're going to inject the nerve with like a painkiller, or we can kill it off completely. So, no, kill it. They were going to inject it with a painkiller, or we'll remove your eyeball and give you a glass eye. Those were the two options. Who would want either of those? You know, what do you do with your eyeball when you take it? Just throw it in the trash can? I mean, it's more valuable here, right? So what I did, we have charts that show, the doctor knows too, where the nerves come from the back of the eye, they go down into the neck, and they come out right in here. There's computer chips all through the spine, all the way down. And I showed her, I said, right in here is where that nerve comes out. And I said, if it's a pinch in your low back, and it can run out your leg called sciatica, everybody heard of that? Why couldn't it pinch up here and go behind the eye there? Because that makes sense to me. So I called it eye sciatica. I made up that word. But So we took an x-ray of her neck too, and that portion of her spine must have been damaged at some point. It was all deteriorated right down. So the poor hole, the nerve to her eye was coming out, was setting up being nice and big like that. It was like 80% down. And the nerves, it comes out in a big cable, like it's like zillions of microscopic fibers, and they spray out to different computer chips and go all over. So we gave her an adjustment to that level, and it went just fantastic, beautiful. I do it in a chair, she was seated, and within an hour, all of her pain was gone. It was like getting an elephant off of her foot. So, and it lasted really good. So she went to this specialist, and this was an appointment. He said, well, what did you decide? Do you want me to kill the nerve off, or do you want us to remove the eye? What would you like? It's kind of like, do you want a cheeseburger, or do you want, chicken? To him, to her, it's like my eye, So she goes, well, I don't want either one anymore. He goes, why? What's? She goes, well, I saw Dr. Harkins right over here, the chiropractor. He showed me where the nerve goes from my neck, down my eyeball, down my neck. And on the x-ray, he adjusted that, took all the pressure off the nerve, and it's been fantastic since. He goes, now you think he'd say what? He did that. What's his name? I want to call him. So when other patients come in with this, I can help them out. Or talk to Dr. Harkins or send them over there, see if that may be a cause. Wouldn't that be a nice thing to do? But he's trained to not do that. So what he said is, well, whatever helps. He slammed the file shut and walked out the door. That's the most arrogant part of Western medicine that I don't like. So he had a chance, the surgeon, to learn something. And so in their world, my brother, the surgeon, he's just retired, but big shot in Wisconsin. Half the clinics in northern Wisconsin, he was the OBGYN administrator of all that. University of Wisconsin, all that stuff. He was in college till he was 31. And what was I getting at? Oh, he told me, we were at his cabin one time, he says, if the doctors don't, they're all the doctors today. In the old days it was different, but today, you work in clinics, they have administrators that watch them. They're not just doctors today, they're employees. And they're watching how much you produce, dollar sign wise, okay? You have to do the services, you have to keep it in-house, you have to do the surgeries, prescriptions. If you don't, he says they get fired. Now you've got, let's say you got $400,000 or $500,000 in student loans, you're a medical doctor. And you've got a house you bought, $400,000 house or more. You've got your trophy wife you found someplace. And you've got a few kids, a couple of cars, maybe you buy a condo or a cabin, and you're going to lose your job. So it's not they're bad people. They have to keep their jobs. And my dad had cancer, multiple myeloma, so he was not getting better, and he was having this medication he was taking, and he was making him go in and out of trances all day long. So I went along with my mom. My dad was 83 at the time. My mom was about 76. So I went to my clinic where my brother was an OBGYN specialist, one floor up to the oncologist department. My brother didn't even come down for his dad's appointment, one floor. So Dr. Mike goes down there instead, the chiropractor. And he always looked at me like I'm down here in life, but I'm not. But anyway, so I asked the oncologist, I explained when he was done, here's what's going on. I said, he's phasing in and out, and he can't, no appetite. I said, is this stuff he's taking every day, is this helping him at all? Good question I asked, right? He says, no, it's not helping him at all. Silence. Then he realized what he just said. But he has to stay on it. So I didn't want to cause trouble because my brother works there, he's one floor. So I took my dad and my mom back to their hometown, dropped them off. The next day I went back to my town where I practiced. The next day that same oncologist called my mom and said, tell your husband, cut it in half. So he felt guilty, see, but my dad had to stay on it, even though it wasn't helping him at all. He had to stay on it so he could keep his job in part, But that's the way it is today. So that's why you have to take care of yourselves today. First, if you need Western med, then you need it. But take care of yourself and teach your children the natural way through life as much as you can. And then you're not dependent on people that are drugging you or doing surgery on you or cutting your eyeballs out so they can keep their job. Heck with that stuff. So, see what's next here. Attitude, behavior. Doctor, I'm sure, saw a lot of kids come in. I've had parents come in with their teenage daughters and say, our next time. Because they're fighting and arguing, you know. The daughters, they notice when the kids get adjusted, they have a different kid. The kid that their creator made, instead of this one that's all stressed out and arguing with. So, next one. Neuroplasticity, the ability, you know, just of the brain and the nervous system to roll with it, and change and be happy and develop and things like that. Pressure on the nervous system messes all that stuff up. It's just, you know, and nothing good happens. What we have, what we're born with, is as good as we're going to get. We're designed to be up here, but everything in life keeps dragging us down here. So you have to actually fight in self-defense to get it back up. We're being brainwashed constantly by these ads on TV. You know, these people, and all those medical drug ads, they study the cadence of the talk, the pitch, the tone. They'll even switch people's voices off in the middle of the ad. Whatever they can do to get your attention, they want to get into your brain, they want to worm in there. Watch those ads next time. I always put the mute button on when they come on. They go for like 3 minutes and they show people running on the beach, talking about, you know, things. When they talk about the suicidal thoughts, which are also murderous thoughts, you know, explosive diarrhea you can get from their stuff, and I mean, all the things you don't want, right? But they all have a real happy scene. So watch that. That's all mind control. They're training you to buy their drugs. The pharmacy companies are awful, awful people. They make some good products, don't get me wrong, but it's all about corporate profit. It shouldn't be about that. It shouldn't be. And then they've got so much money, they're buying the political votes down in the states to force you to have their chemicals injected in your bloodstream, your children's bloodstream, without even you knowing what's in there or what the effect is. And they gave money to the politicians to pass laws. So if something bad happens, if your child's autistic afterwards, brain damage, death, anything like that, after vaccines, you cannot sue the drug companies because they paid off the politicians. Isn't that crazy? You can sue the government, but that's all kept under. Then they hire attorneys to fight you with your own tax dollar. It's just awful. So you guys are on the right track with your natural health care as much as you can. Okay, let's see what else we got. This talks about more of the same, the back pains. Go ahead, Art. Yeah, we're all natural, no pills. Drugs, we talked about that. You're chasing symptoms. We always look at health conditions in the body as like an iceberg. The medics treat the tip of the ice that's above the water. That's what they see. Chiropractic, we look down below, see this huge problem that's we're pushing that up. We want to fix that if we can. Let's see what else we got. Next one. Oh, there we go. Next one. That's the old medicine cabinets. Remember in the old days, the old houses had the medicine cabinet? They don't even make them with those anymore for the most part, which is good. So there's what I just talked about. We'll do the next one. Balance. That little girl on the right there. How many of you could do that right now? You want to stand up and try it? Anybody? Most of us end up on our ear, you know. But think what has to happen in that brain right now for her to do that. Her brain has to know where her fingertips are, where her toes are, where on the right foot, on her left foot. It has to know everything with her eyes shut. How can it do that? Isn't that incredible if you think about it? So the body's constantly listening. It's got proprioceptors, little sensors all over the place. And if her upper neck was out real bad, you'd probably see her, you know, not being able to do that as well. So if you're in perfect harmony and the brain is plugged in, you get to do that kind of stuff. Most of us couldn't do it even with that. But next one, please. And then I talked about the tension neck on the left. That's the scourge of modern society today. It's just awful. It's ruining people's spines. They take care of so many kids that come in now. Mom will come in or dad for an adjustment. The kids over in the corner doing this, and you know they're growing like this. You know, I'm like, you wouldn't look like that. I said, you want to get a girlfriend someday? They don't like guys that look like this. Then they straighten up. Now they come in my office like they're in the military. Let's go to the next one. Anybody play cricket here? always wanted to play that, or you did at one point? I always wanted to get and play that sometime. It just looks like fun. I wanted to do the rowing, you know. In the boats I did that was the crew to join the club. But why don't I do this someday too? Looks like fun. And then on the left, you know, the Indian culture. You guys are big into eating good. Make sure you get your exercise in. That can get lost in the wayside. It gets so busy running kids from here to there, and work and stuff like that, and traveling. A lot of these folks you get a lot of my tech people that I've met, and they're traveling all the time. They're in Wichita, they're in California, and they're home 2 or 3 days a week. It's hard to do with the eat healthy, the exercising, but do what you can, you know, and keep that body healthy. It's your car through life. We have our soul and our spirit, but our body is our car. You can't just keep driving a car because you're going to hit bumps and, you know, get salt on it. You got to take care of stuff. A few minutes yet here. We'll go to the next one. Runners have done a lot of studies on athletes and things of all types. The more body's plugged in with its brain, the more better performance you can get. That's just not on the athletic field, but in the classroom. We want our kids to be all they can be and not be dumbed down. A lot of the kids, they are smarter than the teachers, or not the teachers, but the protocols, stuff they teach us. They only give us so much, and that's all you learn. These kids have incredible minds, so if their minds are plugged in and they're adjusted nice, they got good nutrition, sleeping good, they can actually be doing advanced work when they're young kids and actually know their full potential by the time they're 16, 18. They should be, with the stuff they teach today, a lot of these kids, if they're plugged in and do nice, they should graduate to high school protocol by if they're 14, 15 years old. They should be done with that stuff. Think about it, you know. They can go on to graduate college by the time they're 18, 19. But they slow it all down, you know, and they give you so much a year. Next one, please. Stretching movement. Make sure you do some of this stuff every day. Everything we do is out here, right? Cooking, typing, computers, chiropractors adjusting here, dentists working here, things like that. So we're strengthening these muscles here all the time, the internal rotators of the shoulders. So we actually are kind of looking like this all the time. But there's an external rotator, so you want to get that chest up and out. I always tell folks, stand like a Marine at attention. Take like every hour on the hour if you're at work, just kind of stretch back a little bit. Let your head relax a little bit, okay? And if you sit a lot at work, the body's not designed to sit. It's not designed to stand all day either. So what you want to do is have a stand-up, sit-down desk, so your body loves options throughout the day. Let it sit. I like to get a stool with a stand-up desk. So you can sit for a while, take a load off, and have like in the taverns, I don't know if you guys go to the taverns at all and have a cold beer or anything like that, but they'll have some chicken wings or something, but they got the bar rail. The bar rail is designed for one purpose, and that's to keep their customers' backs from hurting. So you stay longer and eat more chicken wings and drink more beverages. That's all it's for. Because if you have to stand flat-footed all day, you leave after a while. You know? So work is the same thing. So make sure you have like a little rail or a little box or a little bucket or something. Put a foot up there and you can do your typing. Make sure it's at a nice level so your head's not doing this. Think neutral, chest up and out, keep your foot up. And then you can switch to the other foot once in a while. Okay. And then also flat-footed. So you got flat-footed, left foot up, right foot up, or sit. So you got like 4 options throughout the day. Switch off and on. Stretch a little bit, take a little walk, drink a glass of water. And your day's not so good. You want to get up and have a nice day at work. Not going exhausted and another day and you're cranky and crappy. Good production for your employer goes down. Next one, please. And that's the spine showing muscles and stuff. Next one, please. Glutes and hips. That's our butt area, muscles and stuff. Stretching, real simple stretches you can do every day when you get up or at home. Make a T with your arms out, lay on the floor. One leg straight down, the other one over. Do one way, the other way, nice and gentle. Just hang there for a little bit, even if you do 20, 30 seconds each way. Next one, please. And you want to stretch the low back, or stretch the low back. I like this one. Just, anybody need an explanation on that one? You just curl up, just hold it for like 10, 20 seconds, let your knees down a little bit. Do it again, do a few of those. Why not get something back to the body that does so much for you? Your body is giving you children, they make children, make babies. They allow you to make a living. They allow you to have fun and travel. Gosh, give them a little something back, huh? Most of us give it nothing back, right? We give it drugs to force it to do stuff. Next one, please. I like stretchy low back and tight tummy. So start knees up like that, and then you just put your hands on your shoulders, lap on your neck. Tuck your chin in here, and just go up, just like she is there, like Danny is. And and then hold it for a count of like 5. Go down. You don't have to come all the way up or anything like that, but you're isolating your ab muscles. So the tighter the abs, the happier your spine. Okay? Next one, please. That's my receptionist. She's helping us out with that. So if you guys ever want to get checked at all by me or any chiropractor, we got little sheets like that over here. You just put a little X over where it is. I can talk to you real quick about it. Do a little quick consultation for you. I can check on your upper neck if you want to. Next one, please. Yeah, we take care of a lot of families and friends and family. I'm sure Doctor got a lot of referrals over the years. She's a very caring, passionate person. Next one, please. We're in Plymouth. We're over by Cup Foods, by Aveda Spa, on the way to the theater. There's like some condos on Plymouth Avenue in front of Lifetime Fitness. You turn the corner, go up towards the movie theater. I'm going to up in there, the last one on the right. Next one, please. If you know where the school STEM school is, they're my neighbors upstairs. I'm down below. That's my X-ray room on the right over there. We have a big picture of the spine, and we're decorated for Halloween right now. That's our front desk. Next one, please. So welcome to our office. And then this is a few pictures of some of our rooms that we treat in. All right.
I want to praise you.
Thank you for having me, and thank you, Arun, for taking care of all this for me. Thanks for being here, guys. Appreciate it.
Should somebody with osteoporosis come to your chiropractor or no?
Only if they're alive. Okay? But that is a good question. It really is, because we see a lot of osteoporotic patients. Sometimes the MD will say, oh, you have osteoporosis, stop going to your chiropractor. Well, the chiropractor is doing things to help keep the bones strong and alive. When they're lined up really nice, they bear weight properly. And there's less chance of arthritis, and the bone can actually stay stronger. There's a law of bone, it's called Wolff's Law. And a law is a law, it's like law of gravity. It's not fake. If you put stress on a bone abnormally, it starts to shape and get weird. Okay? If you put a lot of stress on a bone, it gets tougher and stronger. So we want the bones to line up nice. So even though our bones are in a weakened state, they'll be as strong as possible with what we do. So in the work we do is not necessarily forceful or anything like that. It's gentle, it's quick little motions, and it feels really good. We take care of babies. My oldest patient's got like 103. And she was from Minnesota, so she was really sassy.
Yeah.
So her 7-8-year-old son said to me one day, I'm going to bring my mom in. Oh, great. She was 103 years old. She went back to college at 65, got her degree. And yeah, so. Thank you. Oh, got one more.
In one of your slides, it was written that chiropractors can also help with allergies. How does that work?
Yes, that's a great question. So every function of the body is controlled by the nervous system. Every function. So like allergies and things, that's your body's inability to deal with allergens. Things that normally it should be able to deal with, whether it's dust, pollen, cat hair, or food allergies. The body's designed to handle that stuff. So when there's an interference with the sensors in the system, to feed back to the brain what's coming in, or the brain to tell the body what to do with certain allergens, the body it's in flux, doesn't know what to do, and it responds best it can, inflammatory responses, it starts shutting things down, doesn't know what's going on. It's a chaos in that area of the body. Okay? So when you get adjusted by a chiropractor, there's the sympathetic and parasympathetic nerves we talked about. There's a special balance that we sell. We check the areas of the spine for that. So if, let's say you get allergies up here all the time, and we'll check the neck. We'll open up the nerves, and you'll see the blood flow to the area increase. Immune system function, it starts plugging back in. The body can deal with that better. Now, it may not clear out everything, but it gives your body the best chance to deal with it. And there's a lot of man-made junk around here. Our bodies, it's a total foreign thing to our bodies. It freaks it out. It's like vaccines and stuff.
I have a question.
Thank you.
Sorry, I have a question.
Yes.
There's a correlationship you're showing with yoga. Is there a correlationship with acupressure?
Yes. So is acupressure good or?
Is there, because you're talking about
nerves.
Yes. And in the, one of the principles of acupressure is that you press the nerve and it sends a electronic or whatever sensory application to the brain.
So that's another way. There's other ways to access the computer system of the body. Acupuncture, chiropractic, massage, those things. If you find the areas that you can stimulate to help the system, it's all good. It's all good stuff. I love all of that. It's all good. I love chiropractic as a fundamental basic one because even if you have subluxations or stresses on the spine, and you do things perfectly, it's still messed up here. So you just want to get that open, and then these other things can really come in and really do a beautiful job too if you need acupuncture, acupressure. Okay? Thank you. Yes, Doctor.
Just something for the last two questions was, one of the things I wanted to tell you was my daughters, both of them had allergies, and I treated them throughout when they were little. And as far as acupuncture is concerned, basically those are blockages, okay, which are peripheral. And so when you do acupressure or acupuncture, basically you're removing the blockages, right? But still, if we are still not getting to the root cause, because they're like chakras, right? Meridians with acupressure. So when you put pressure, you're taking the blockages out, but you're still not getting to the root cause because all these are nerves. So it all starts from the spine. So when you really adjust, really you take care of all that peripheral, all those blockages will be removed.
I enjoyed your talk.
Thank you.
My question is,
Yes.
can you help with hearing loss?
Well, that's a good question because the very first chiropractic patient was named Harkins. And Dr. Palmer, who started chiropractic in 1895, Harkins was a janitor in his building. And Dr. Palmer was into a lot of whatever healing arts he could be in at that time, magnetic healing and stuff. So the janitor said to him one day he bent over and something popped in his neck right here at the back. And his hearing went out just like that. He said he couldn't even hear the wagons on a cobblestone street full. Dr. Palmer said, well, that's interesting. So he started, if something popped out of place, maybe if it popped back in, it'll go on again. So there's a lot of causes of hearing loss. But anyway, so he talked this guy into letting him work on his back. And I guess it took a long time to talk him into it. Harry Little was a black man too, which is really cool. So he had just gave the first chiropractic adjustment was manipulation of the spine has been around for ages. But this is a system of evaluating the nerve system with certain levels. So he had adjusted this man's spine, and the gentleman's hearing went back on again. Okay, so yes. The short answer is yes. That was a long answer. Thank you.